Today is June 9th, and you'll be surprised to hear that I'm actually in a much better frame of mind about everything than I have been in previous videos that I've posted. Obviously, I'm still having the surgery. Nothing has changed along those lines, but things have gotten better for my state of mind. A big part of that is that on June 5th, I went in and had a meeting with Dr. Hutchison, who is the surgeon who's going to be doing the work on me. And she explained the medical situation just very clearly, so even a dummy like me could understand that she's going to do 3, possibly 4 bypasses. While she's in there, she's going to do an ablation. That is to address the long-term potential of atrial fibrillation, not permanent, but longer term. And she doesn't think that I'm going to need a valve replacement. It's possible. When she gets in there and sees things, she may come to a different decision. But as of right now, based on the pre-surgical tests, she doesn't think that's needed. Strangely enough, if they do it, they use a cow's heart valve and not a pig's heart valve. So I'm wondering if they do that to me, if I'm going to be guilty if I eat hamburger after all this is said and done. I don't know. The surgery is scheduled for 12:30 p.m. on Tuesday, June 25th. So we now have a date. Other points. I asked about my big fear, something I talked about in a previous video or two, which is waking up to find a ventilation tube stuck down my throat. She explained that they use some drug that basically keeps you from remembering. It's like Rohypnol, a date rape drug almost. No, but it's something so that when they wake you up and pull out the tube and everything, you don't remember that took place. And that makes me feel very good. That it's like if I don't remember, it didn't happen, right? I know, dangerous mindset, but in this case, I think it's a good thing. As I think I've mentioned before, for at least a month, I have to ride in the back seat of a car like I'm being chauffeured around, because if I'm in the front seat and we get into an accident, the airbag deploys, the airbag strikes me in the chest with the damage that's done to my chest from the surgery that hasn't yet healed. That could cause serious injury or even death. So I get to be chauffeured for a month afterwards. My risk of dying from this is about 3%, based on the statistics. I think it's probably better than that, but 3%. Additionally, I face a 2% risk of complications like bleeding or an infection or something like that. So basically, I have a 5% chance of seriously negative outcomes from the surgery. Another way to say that is I've got a 95% chance of not having seriously negative medical complications as a result of this. So that's a good thing. Additionally, the ablation that is intended to keep me from having atrial fibrillation longer term could actually trigger atrial fibrillation, because you're doing that, you're cauterizing spots on the heart. It basically pisses off the heart and throws it into an irregular heartbeat. That can happen, in which case I'd probably need another cardioversion or an electrophysiologist ablation, an EP ablation, which I think is they go in through a vein and do. I believe that's how they do that. But so there are negative consequences, possibilities from this procedure, but the percentages are like Hunger Games. They're ever in my favor. So that's a good thing. Dr. Hutchison echoed Dr. Lee's comments that I have been through a lot this year. you got sepsis, you got ketoacidosis, you got massively high blood sugars, 3 strokes, congestive heart failure, atrial fibrillation, and a cardioversion. And their observation is that I'm actually in much better condition than what they would have expected for someone who has gone through everything that I've gone through. So I'm encouraged by that. And that speaks to me being a good candidate to have this work done in the first place. During our conversation, Monique passed along my suggestion to make this a more value-added procedure for me, that when Dr. Hutchison has me opened up, that she actually put in a cup holder in my chest. So I got a place to put my beer when I'm laying in bed watching TV. Dr. Hutchison thought that was really funny, but I think we agreed that the insurance would not pay for it if she did. So much for that idea. And one other thing, just explained that they use something called a nerve blocker, which I'm assuming is a medicine, and they do that to minimize the pain in the chest for the first couple of days, along with other medicines as well. And during that time, I guess they also remove drain tubes, which is something else I hadn't considered. While I guess those nerve blockers are in. Overall, I thought it was a really good appointment. Dr. Hutchison was terrific. We all had several laughs and everything. We were able to joke around about things and have a really good conversation. I felt very good about that, to the point where we here are actually at times making jokes about this whole thing. Like, we were coming up with signs that we could put on my chest for when I go in for surgery. You know, and they lift up the smock and they see a sign that says "cut here" or the dotted line, or "please refrigerate after opening." You know, things like that. So, morbid as it may seem, we've actually been having a little fun at my expense, talking about this sort of thing. So mentally, emotionally, I think I'm in a better place now. I got some answers that I wanted to hear for a change, and the surgery is scheduled, and it's just a matter of going in there and getting it done.